Hey, I'm Tamara Kandaker, and this is the Decibel from the Globe and Mail. So nurses have been on the front lines of the COVID crisis since day one. And the pressures of the pandemic have forced them to work themselves to the point of exhaustion without much time to process their own grief as they've watched countless patients die in front of them. And 16 months into this, for some nurses, it's all gotten to be too much.
I quit straight up the beginning of June. And with nothing else set up and nothing else on the horizon, I couldn't take it anymore and just quit.
That's Lindsay Goff, and she'd been a nurse for 12 years before quitting her job earlier this summer. She said her mental health was suffering to the point where work had just become unbearable.
I was having anxiety attacks every time I was going into work, where I would feel or be physically ill. I felt like I was going off to war or prison.
Lindsay's not the only one, and the pandemic has only added to staffing issues that already existed in hospitals and in long-term care. And Kelly Grant, the Globe's health reporter, is here to tell us what's behind the exodus. Today on the show, why nurses are leaving the job, why this is bad news for the healthcare system, and what the government needs to do to fix it. You're listening to The Decibel. Hi, Kelly. Welcome back.
Thanks for having me.
So you talked to a nurse named Lindsay for your story, and she quit her job in June. And I was wondering if you can tell me a bit about her and why she decided to leave her job.
Well, she left the job really because of the high workload and stress of working in a critical care unit during COVID in Ontario. She's the kind of nurse who the system really needs right now. She's got about 12 years experience, 5 of them in the ER and another 7 in critical care. But she just found the pressures of working in an ICU during COVID to be too much for her. She did try to drop down to part-time in January, and that helped a little bit. But then by June, she just thought, I can't do this anymore. And she said to me that it was a combination of just the incredibly heavy workload, caring for more patients than she normally would on a shift, overseeing, nurses with very little critical care experience, if any, and then also the emotional toll of seeing patients go onto ventilators in the critical care unit and just seem to not get better.
Even on my days off, I couldn't fully come down from the ongoing stress of work and the workload. I found myself crying at work multiple times or really trying hard not to cry.
And it sounds like the mental toll got pretty bad. I listened to your conversation with her and she was telling you that she was having anxiety attacks at work and that she felt like she was going off to war or going to prison when she was headed off to work.
Yeah, that is really how she described it. She found it was really hard on her mental health. I mean, one thing she mentioned to me that I could imagine being incredibly difficult was feeling like you never had enough time to do your job well.
You just felt like you could never do the job properly, or even some days it even felt like you couldn't even do 50% of what you should be doing. So yeah, that was very draining.
And this sort of mental toll of thinking, did I make a mistake today in my haste? I think all of those things really did get to her, and she decided to leave in June.
And I know she had been working as an ICU nurse for a long time, and she obviously knows how to handle stress, but how did work change for her when COVID hit? What happened at that point?
Well, she said it was really 2 things. It was both workload and the sort of emotional sorrow of being around a lot of COVID. So on the workload front, I mean, it's not like things aren't busy in the critical care unit. They are. But as a general rule, she would be doing one-to-one nursing. So that's very common in ICUs where, these patients are so complex that usually there's one nurse per shift assigned to that patient. And you can really give them all the attention you need. She had worked in the Niagara region, and when they hit, some of the real heights of the second and the third wave, then she said sometimes she would be in charge of 2 patients, even 3 patients. Now they would often sort of try to help her with what are called nurse extenders, where you take redeployed nurses or even in some cases, doctors, and have them come in and try to help you out. But those tend to not be people who have much experience, if any, in critical care. And it's really high-level nursing. So what changed for her was the workload was very significant. And then it was the makeup of the patient population, because I was really interested in that as well. I mean, it's not like you don't see people very sick and dying in the ICU under normal circumstances. Yeah. But she said there's usually a mix of patients, you know, who come in and are expected to get better. With COVID, she said she just saw so many patients who went onto a ventilator and, you know, unless they improved pretty rapidly and were out in a couple of days, once they got onto the ventilator, they were often on it for weeks.
These are otherwise young, healthy people, 40s, 50s, 60s. And, you know, they're not ready to give up. Their family's not ready to give up, but they're still so sick. And you never see them getting better. And I think that's what I struggled with, is this completely hopeless situation that was just this depressing.
Yeah, that's really heavy. And how common is Lindsay's story? How many nurses are leaving or have left the profession since the pandemic started?
So that particular number is difficult to come by. And the main reason for that is that, data generally tends to lag on almost every front in Canada. But in the case of nurses in particular, they all belong to a regulatory college that issues licenses. And when I was reporting this story, I got in touch with all of the regulatory colleges in the provinces and territories to ask this question. And what most of them came back to tell me was that, you know, oftentimes if nurses decide to retire or quit, they don't necessarily turn in their license right away. So somebody like Lindsay, you know, has not turned in her nursing license because there is, at this point, she's not sure what she's going to do. And eventually she doesn't want to close the door to going back. So somebody like Lindsay wouldn't be at all captured in the statistics that the colleges have.
Right.
So we have to rely sort of on a bit of anecdotal evidence, speaking with nurses and doctors and administrators at hospitals. And we can also look at something like this Statistics Canada job vacancy rate, which in its most recent report said that the healthcare professions basically had the highest vacancy rate of any sector in the economy as of the end of the first quarter.
And where are we seeing nurses leaving result in problematic shortages or hospitals having trouble managing their patients because of a lack of nurses?
So we're seeing that in a lot of different places. I should give you a little bit of context before we talk about this, and that is that right now it's the summer. It is true that a lot of people take vacation in the summer, and especially in rural and remote parts of Canada, it is not totally out of the ordinary to see things like slowed down operating rooms, bed closures, and reductions in ER hours because, you know, there's a few weeks in August where they have trouble filling staff. Now, oftentimes, anecdotally, what I have found is that that is often because of not being able to find doctors. So like a small emergency room will close because they just cannot fill the night shift for 1 week in August, despite how many locums or traveling doctors they try to get in. What seems to be happening now is just a wider array of closures, and that they seem to be related to nursing. So to give you a couple of examples, in Quebec, there have been several hospitals where they have scaled back the number of beds, they have temporary closed emergency rooms, they have shut down emergency rooms at night, and they've come out and said it's specifically because we cannot find enough nurses to fill these shifts right now. There's been a bit of that in Alberta, there's been a bit of that out on the East Coast. None of it announced on Friday that several of its health centers would close for a few weeks in the summer because they can't find nurses. So what I see as being different now is this idea that the reason you're seeing some of these closures, you're seeing more of them, at least anecdotally, and that they seem to be related specifically to nursing shortages.
And where are these nurses going? Are they just quitting their jobs without something else lined up? Like, what is their plan after they leave?
Yeah, so again, I have to rely sort of largely on anecdote here on a couple of surveys, but the things I've heard range from early retirements. There is people dropping down to part-time hours saying like, I don't want a full-time job that is this many hours because it's too much stress. In some places, I've heard a fair bit about nurses leaving the public system to work for private staffing agencies. That came up a lot in speaking with people in Quebec in particular, but it is an issue in some other places as well.
So you mentioned that we do see staffing shortages in summers because usually people are taking vacations, but I feel like I've been hearing about staffing shortages in nursing in general for a long time. And I wonder, how bad was the problem before the pandemic and what was causing it?
So it was a problem before the pandemic. The full scope of it is, I think, not terribly well understood because, we don't have great health human resources data. However, the thing to think about is that the raw number of nurses we have doesn't really tell you everything that you need to know. Oftentimes, the issues of where the shortages are worst have historically tended to be by location and by the type of profession. So, for example, rural and remote communities often have a hard time attracting and keeping nurses, especially nurses with specific specialties like, say, labor and delivery or critical care. And then there's also shortages by profession. So one thing I didn't have a chance to get into in this story that I would love to write more about is a real difficulty in trying to attract nurses to the long-term care sector, which I think, anecdotally I'm hearing has been made significantly worse by, just how badly these homes fared during the pandemic.
What did you find out about that? Can you tell me a bit more about the situation in long-term care homes?
There has always been a difficulty trying to attract nurses to long-term care. I mean, it's better and worse in some places, so I don't want to totally generalize. But, at least in Ontario, there is a requirement that there be at least one registered nurse on site at all times at long-term care homes. And there has just been historically difficulty trying to attract nurses to that profession. It's really tough work. The patients often have a lot of comorbidities, a lot of dementia. It's night shifts. It's, some places don't offer full-time jobs. I mean, one thing that always sticks out in my memory is I covered portions of the Wettlaufer inquiry. And for people who may not remember that story, that was a case of a nurse named Elizabeth Wettlaufer in southwestern Ontario who was convicted of murdering 8 of her patients using high doses of insulin. And during that public inquiry into what happened there, one of the things they really looked at was like, this nurse, she didn't have a great reputation. She made mistakes. She had issues. And part of the reason why it seemed like she kept getting another chance was because the industry was just so desperate for RNs and they need an RN on shift at all times. And so, that inquiry really looked in depth at how do we attract more nurses to that role. So that's been a longstanding problem, and the pandemic has not made it any easier for people trying to hire.
Wow. So other than Lindsay, what do the nurses that you've talked to tell you about why they're leaving and how things have changed since the start of the pandemic? Like, how have their jobs become more difficult, more stressful?
Well, let me give you one example that I think might illustrate some of what they're facing. Another nurse I spoke with, who I didn't have room to include in the story, was a nurse in Quebec. He worked in an ER in Montreal. And, one of the things that came up a lot in speaking with people in Quebec was this idea of compulsory overtime. And so as things got worse and worse during the pandemic and nursing hours were needed more and more, oftentimes nurses would finish a shift and their bosses would come and say, look, I need you to stay for the night shift, right? And so they might wind up working 16 straight hours. Do that a few times over a few months, and it starts to really take a toll on nurses. So this particular nurse I talked to decided to leave for a private staffing agency. And the private staffing agency has actually been placing him in clinics in northern Quebec in the Inuit communities there. And he really likes the work. It's really important nursing. Like, we absolutely need nurses to go and work in some of those remote parts of the country. But for him, a huge draw was that he had flexibility and control over his schedule.
Yeah.
That seems to be a big draw for nurses who are considering leaving private staffing agencies, who feel as though they don't have the same amount of control over their time and schedule, and that they may be asked to work a lot more overtime than they're capable or willing to work. And if you go to some of these private agencies, oftentimes the hourly pay is a bit better. They usually don't provide a ton in the way of things like pensions and benefits, but you may get higher hourly pay and you may have more control over your work schedule, which, is important for a lot of people in different professions.
So it sounds like it's a combination of things like mandatory overtime, increased workload, having to supervise, nurses who maybe aren't trained to do this kind of work, on top of this low morale that comes with seeing patients just die more frequently than you normally would.
Yeah, and I think the morale thing also has to do with the sort of community or public attitude towards COVID. I do know that it has been hard on some who work in healthcare, including nurses, to go to work every day and care for people who are sick and dying of COVID, and to feel as though the people around you outside of the hospital perhaps don't take it seriously or think it has been blown out of proportion. And it's just dragged on for such a long time. I mean, yep. I should say that, things are much better in Canadian hospitals at the moment as far as COVID goes, where, there's far, far fewer patients now than in the spring or in the winter. So from a COVID perspective, the hospitals are actually in fairly good stead right now. But they're seeing a huge number of people who didn't get proper care during the pandemic, who are now in worse shape than they would have been if, for example, their chronic diseases had been properly managed or they'd been able to get regular, adequate health care during the pandemic, and they didn't. And there's just a massive backlog of surgeries that needs to get moving as well. So COVID is much better as far as hospitals go, but that doesn't mean the healthcare system isn't under other types of pressure.
People who are aspiring to become nurses, they must hear about what's happening in the sector and read these kinds of stories and talk to people they know who are nurses. And I wonder if this is having an impact in recruitment and, people going to nursing school, and could this have like a long-term impact?
That's hard to say. I think it's something we'll have to watch closely over the next couple of years. In general, one of the other effects of the pandemic has been that, for a time you saw people outside banging pots and pans for nurses. There's a lot of these people are our heroes and angels. And, I think in some ways that, despite the workload issues, there has been a larger societal recognition of just how important and valued these jobs are. So how that will affect applications to nursing school, it's hard to say. Historically, it's not been like they couldn't get anybody to sign up to nursing school. Like, you have to have really high marks to get into nursing school. It's competitive. I think one of the things they'll be considering now is, how much should we be expanding slots in nursing schools by? And there does seem to be some enthusiasm among provincial governments to try to train more nurses, but that does take time.
Do governments acknowledge that this is becoming a problem, and what are provincial governments doing to keep nurses on the job?
Yeah, so it seems like at a theoretical level, they do recognize it and they are trying to take some steps. But at the same time, people within the nursing community, and particularly nursing unions, would like to see some more done to retain nurses. So to give you an example, the government of Ontario, at the beginning of this year, when they were trying to expand the number of critical care beds, they decided to start offering a bonus program to certain hospitals that were getting these expanded beds, where they could offer bonuses up to $75,000 for experienced critical care nurses who were coming from outside of the province or returning from being retired or unemployed. The idea was they were trying not to siphon nurses, from other hospitals within the system. They were trying to bring new nurses into the provincial system. And, there are some hospitals I spoke with who really appreciate that program and think it's great. But then when it comes to the nursing leadership, they look at that and say, look, we think this is a temporary fix. What we need is something more long-term. And that includes better, higher wages, right, for our nurses. That's a big issue, is pay is an issue. Benefits are an issue. Workload is a big issue. So long-term, I think the position of a lot of nursing leaders is like, if you want to both attract new nurses and keep the nurses you already have, then, it can't be one-time bonuses here and there. It needs to be permanent, sustained wage increases and other things that make the workplace just a better place to be for nurses.
But in the short term, it feels like this is a bit of a crisis. So how are hospitals going to cope in the meantime? Is it just going to be through these kind of temporary closures, or how can hospitals fill the void of these nurses who are leaving?
Well, it's going to be tough. I think one thing we need to watch is looking at September, October, when we're through the summer vacation season, and see how things look then. They can keep trying to recruit. They can keep, Alberta, for example, told me when I spoke with them that in the last year they had hired something like 1,000 nurses. Like, they are still trying, they are constantly recruiting, but I think we would be fooling ourselves if we didn't admit that it may have some effect on, the level of service that's available to Canadians, on the ability to ramp up surgeries. And I think the thing it really underlines is how important it is that we continue to keep COVID under control. It really is amazing how, when COVID is out of control, in the pre-vaccine era in particular, how quickly our systems could be quite stressed by COVID. So I think probably the biggest thing everybody can do is just rush out and please get vaccinated. And that will help to keep the system from being overwhelmed, considering we just don't have an endless supply of nurses.
Okay, Kelly, thank you so much for this. I really appreciate it.
Thanks for having me.
And that's it for today. I'm Tamara Kandaker. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show, and Angela Pacenza is our executive editor. Thank you so much to Kelly Grant. You can find her on Twitter at KellyGrant1. If you want to reach us, we're at thedecibel@globeandmail.com. I'm on Twitter at Anima_TK. Thank you so much for listening, and I'll talk to you tomorrow.